Hi everyone, welcome to KES 234, Care and Prevention of Athletic Injury Online. My name is Dr. Chris Waters Banker. I'm a new assistant professor here at the University of Hawaii Hilo in the Kinesiology and Exercise Science Department. You may please refer to me either Dr. Waters or Dr. Banker. I don't expect you to use the full long name. It's not a big deal whatsoever. Either one is just fine. I wanted to do a short video here on just the syllabus, just to make sure that I highlight a couple of the really important things that I have listed on here, and just speak kind of in a general conceptual way of what we're going to be doing in this class and how I'm going to structure this class. I know that I've mentioned through email this is the first time that I've offered this class online, so I'm definitely very open to your feedback, especially if you've taken online classes before and you know what works for you. I am really open to hearing out those types of learning tools, because I want to make sure that this information is really accessible to you guys. It translates easily in this online format, or I guess as easily as it possibly can. So definitely keep in communication with me and each other too. Like, use the discussion board and the chats and stuff to talk to each other about different things that we go over in class. And if you still feel like you're missing some crucial component, definitely email me or reach out to me somehow. If you are in the Hilo area and you want to stop by my office and chat, I have office hours from 1 to 2 on Monday, Wednesday, Fridays. Or if that doesn't necessarily work with your schedule, email me and we can set up a different time. So in this class, we're going to be talking a lot about athletic injury and the care and prevention of it. So that's actually a profession called athletic training, or a certified athletic trainer. Deals with athletic injury. So I'm going to be talking a lot about that. That is my personal background. I am a certified athletic trainer. And it's what I'm really passionate about. So this is definitely my favorite class to teach. I really love this one, and I hope that you guys enjoy it too, because it is a really fun class. But it is really similar. Even if athletic training is not necessarily your goal, maybe physical therapy is, or a PA, or even a doctor, this is a phenomenal foundational course for those professions as well, because it's very similar. AT and PT, very, very similar professions. PT deals with more of the general population and treats things that I would never treat, like someone who maybe has suffered a stroke or a heart attack. I don't know the first thing about doing that type of rehabilitation, but athletic injury is my specialty. So people who are physically active and usually competitively active are the people that I specialize in, and is what athletic trainers specialize in. So I will mainly be talking about that, but just keep in mind it can be easily applicable to lots of different things. It's a phenomenal class if anyone's interested in going to medical school for orthopedic surgery. Fantastic class, because you will do a lot of these same things. Athletic trainers often work alongside of orthopedic surgeons all the time in clinics. I have before, others have and currently do, and some even get special certifications to assist in surgeries. So lots of jobs available. We'll talk about that in the first lecture. Prerequisites. Currently, there are not prerequisites for this class, but that will soon change. It is recommended, highly recommended, that you have taken anatomy and physiology, or you are concurrently taking it with this class. Anatomy is just really important for this class to recognize structures that are damaged, essentially. One of my older professors that taught this class, her philosophy was anatomy. Just the word anatomy. So knowing anatomy is going to give you a leg up on this. If you haven't taken anatomy, don't worry. Just know that you're going to spend a little bit more time diving into the anatomy, and I have additional resources that I'll be posting to help you do that. Okay, and we'll talk about those, and I'll refer to them in your modules. The text for this class. So, care and prevention and athletic injury. the Athletic Injury Management, Essentials of Athletic Injury Management by Prentice. 10th edition is the newest edition. Came out a year and a half to maybe 3 years ago, I think. You can look for earlier editions. There isn't much difference between 8 and 9, I believe, in this one. So you should be good. Anything more than that, just give me a heads up so I can double check. Not too much changes from edition to edition, but sometimes they add like whole chapters and change some of the chapters around, so just let me know and I can help you out. The additional reading I have listed is the big one, is the Principles of Athletic Training, the super big textbook. It's pretty spendy, it's hardcover. It's also by Prentice. It's the more expanded version. The one that I have required for this class is a summary. I have this as additional because if you are really interested in going to athletic training, I would highly recommend either getting this book now or at some point in time, because you will eventually anyway. It's required reading for athletic training programs, and the national certification exam is based off of this book. You'll use it a lot throughout your education, so that's what this one is. So I'll let you guys read through the objectives. The big thing is we're going to be learning about care and prevention of athletic injury. That's what this class is about, and all the things that entails. So you're definitely going to learn about the role of an athletic trainer, the scope of practice, the limitations, the expectations of that job, and I'm going to discuss those things a lot throughout the course of this class. But the big thing really is to be able to explain, describe, and discuss anatomy and terminology that are really pertinent to the injuries that we're going to be talking about. Especially recognizing mechanism of injury. We're going to talk about that a ton. Recognizing mechanism of injury does a good portion of your job for you so that you can assess it and diagnose it appropriately. We're going to be talking about tissue properties, we're talking about inflammation, we're talking about a lot of really good foundational knowledge before we dive into the specific injuries at each individual site. We're going to be talking about injuries at foot, ankle, knee, hip, spine, shoulder, head, face, concussion. So we're going to be going over a lot of things, and in the first part of the class we're going to have a lot of foundational knowledge to build upon there. We're going to be talking mainly about acute injuries. We will talk about some chronic injuries, but we're not talking a lot about treatment or rehabilitation, and we aren't able to go through really the special testing component of it. That would require a lab and is a little bit more advanced beyond this class. So it's mainly going to be how to take care of situations in the emergent time, in the acute, first few hours of an injury type of treatment. We're going to be talking about how to handle blood and bodily fluids, how to prevent athletic injury, and then because we're going to be doing a research project in this class, learning how to evaluate, critique, and discuss pertinent information in sport injury and emerging topics in evidence-based, because medicine should be evidence-based, and so we're really going to focus on that in this class. As you can see here, this is the course content. I have it listed out. We will go in this order, unless for some reason I switch it up on you, I'll let you know. But this is the order we're going to go in, and I don't have strict timelines to it. I think similarly to an in-class, I don't want to rush through things. So in some cases we spend 2 weeks or more talking about a particular body part, like the spine or the shoulder, for example, because they're very complex. And I want to treat this online class similarly. I want to break apart the modules in a way that you can absorb these information bits at a time rather than having to cram it all in there at once. So that's also going to be reliant on the feedback that I get from you guys. If you feel like we're missing something or we need to slow down or cover a particular concept in a little more depth, please let me know, and I'm happy to create a little module about a concept within the lecture that wasn't clear. Okay, so I want to be accessible to you just like I would be accessible to students in class. All right. So you see we're going to go through quite the plethora of topics. if we do get pretty involved and go off on like a little tangent in one area or another, there are certain things that I can modify or take out, and I will continually keep you up to date on that if those things change. Let's see here. So I have important dates listed. One that I forgot was Martin Luther King Day, which is next Monday, which doesn't particularly pertain to the online version, but the main things are highlighted here, and they're your due dates for the pamphlet research topic that we're going to be doing. I'm going to have a whole module set aside just for the research project, so that's going to answer hopefully all of your questions that you have about that. So hold tight, we'll get to it. I don't want to spend too much time in this one talking about it. But we will do this research project. Traditionally, I've done it as a group project, but this time I'm going to do it as an individual project. It's evidence-based. I'll show you how to do the online searches for the journal articles to get your information and what will be expected of your pamphlet. I will also be posting a rubric online, so I'll have one module dedicated to our research project, to this pamphlet project, that will have a rubric that shows you exactly what I expect for you to be in your project, and that rubric is what I use to grade you. So you will see exactly what the grading criteria is, so you can maximize your ability to get the best score that you can. There's going to be 6 assignments for this class that are spread out. So not every module will have an assignment, but you might have an assignment that kind of has been built by a few different modules and then resulted in an assignment. Those assignments will be clearly outlined with due dates. So please get those in on time. If you are a day late, I'm going to have to dock you 10%. If you're 2 days late, 50. And then on the 3rd day, you're going to get a 0. So please be on top of your due dates. As I assign due dates, I will update them in the calendar on the Lima, so you can always go to the calendar if you forget, but it's going to be clearly listed everywhere on this site. We are going to have 2 exams, a midterm exam and a final exam. The midterm is going to emphasize the material we cover up to that point, and then the final, it will emphasize the material covered after the midterm, but it will still be cumulative, because a lot of the things that we do in the beginning are foundational, and they build and build and build. And so your knowledge of everything that we learn in the beginning definitely will apply at the end, and you'll be able to show a very conceptual understanding of what you learned in this class and how to apply it to injury evaluation, care, and prevention. So I might not ask a specific question relating to Lecture 2 on the final, but concepts from Lecture 2 might definitely be involved in the questions that I ask. So that's how the exams are structured. It's pretty impossible not to make a cumulative exam for this type of course. So as far as the exams go, we'll either do them online or at a testing center, but I will notify you beforehand how that works. Extra credit opportunities. I might offer them, I might not. It really just depends on how the course goes and what I feel like doing. I know that sounds really ominous, but I have done it sometimes in class, especially when I feel like students need a chance to really show me that they've mastered certain topics if their test scores are lower than what I would expect. And I found them to be helpful, because they're always going to have a purpose. They're not going to just be extra credit for extra credit. You're going to have to show me some knowledge. I use them as kind of a make-up for maybe something that was lacking previously. But if I decide not to, then I decide not to. So we'll see what happens during the course of the semester. But please don't ask for extra credit opportunities. I will give them to everyone if they come available. So you can see the breakdown here of how the grading is going to go. Your pamphlet's going to be worth 15% of your grade. The 6 assignments also 15%. Your midterm's 30 and your final exam is 40. And the grading scale for this class is really straightforward. Typical grading scale. And I have my note in there about how I feel about grading scales and what my expectations are. I've made it a point now to say this in all of my classes, but A letter grade of C means average. It means that you're not doing awesome, but you're also not doing bad. You're doing what's expected. Doing what's expected means doing this, watching the videos, following through with the assignments, studying for your exams and getting decent scores. But if you want to be your A in this class, then that means going above and beyond, above average. So that means putting in the extra study time, regular study time, trying to formulate some, study groups if possible. I'm sure you are more than welcome, if you're in the area as well, to potentially connect with some of the students that are in class too and form study groups if you'd like. Or use the chat and discussion, especially if you're on a different island or something. I am more than happy to try and facilitate these things for you guys, because that is how you really get true mastery of the knowledge. And just evaluate what your personal goals are for this class. If you need an A or a B in order for admission into some sort of graduate program after graduating from UH-Hilo, then that's your personal goal, and you need to try and meet it. So that means evaluating what is necessary for you to do to get that grade. So at the end of the semester, I always get emails, about grade adjustments, and I will not do that. I can't do it. It needs to be based on merit, not on favor. If I did that for one person, I would have to do it for everyone, and at that point, why not just give you all A's? And that's not ethical. So please don't ask. I don't like having those conversations, and I can refuse the right to, or I reserve the right to not even answer those requests. So please just do what you need to do for this class, and if you need help, ask as soon as you can. Ask early so that I can help you the best that I can. When you're contacting me, I know because we have this online format, it's a little bit difficult sometimes, or sometimes things get lost in translation. Just be sure to review your materials beforehand and try to really ask me good, thoughtful, and specific questions so that I can really pinpoint where it is that you need help and give you the most helpful advice that I can. If the question's rather general, it makes it hard for me to understand where it is that you're needing that extra bit of information or help. Plagiarism is another thing I want to make sure to point out, because we're doing this pamphlet project and it is a research-based project where you will be writing and reporting and summarizing the literature that you read. It's very important that you do not plagiarize that material. Any single offense that you make, whether intended to or not, will suffer consequences. You will, at the least, get a 0 on that project, or you may fail the class. The third potential consequence is being expelled from the university. So I take plagiarism very, very seriously. If you aren't sure if what you're writing falls under the category of plagiarism, feel free to ask. I am happy to answer that question for you, and I will not get upset whatsoever. I will commend you for asking me the question, because I am happy to figure out any way possible for you to say what you want to say without plagiarizing. Even if you want to use a direct quote, that's okay, as long as you cite it appropriately, okay? So keep an open dialogue with me on that. My general rule is that if I feel you haven't really been versed on what plagiarism is, I will have that conversation with you. It will be an in-person meeting in my office. Once it is understood what plagiarism is, I will file a report to be held at the VCAA office, the Vice Chancellor of Academic Affairs, so that there's a record saying that you and I have had this conversation, you are well aware of what plagiarism is, and if you go into another class and you plagiarize again, that would be a repeat offense, and there would be record on hand that this was that you did so knowingly, and that may lead to expulsion from the university. So please be careful. Know that we have lots of software available to us to find out if you're plagiarizing. So it's a lot easier these days to find plagiarism. Additionally, I will warn that plagiarism is also considered if you pay a service to create a document for you. I know that these services exist. I've seen them. Passing off someone else's work as your own is plagiarism. Okay, and it's easy to find out if that's been done as well. So please, please, please do your own work and let me help you if you need help. There are other resources available that are listed here in the syllabus. So please go through those. At the very end, I've also added a link that has all the additional resources from the university with all the current contact information. So there are tons of resources. I know that not all students are aware of them. Most aren't, I find, and that's okay. We don't expect you guys to be. I'm here to help you navigate those. That document can help you navigate those. But even if you're not sure what you need help with, you just feel like you need help, just talk to me, because I can help you navigate that and figure it out. Okay, that's part of my job. So please utilize me as a resource. All right, so I'll leave it there for the syllabus video. And I'll be posting additional material for the lecture videos. How I plan to do that is that you guys are going to be responsible, because this is an online course, to read your textbook, to go through the PowerPoints that I post online, and then what I'm going to be doing is selecting some of those slides, especially ones that are very conceptual to the full topic, and really highlighting important points and sharing real life situations and stories with you guys, because I feel like that's one of the best parts of class is when I have the opportunity to do that, and that seems to be what students really enjoy hearing as well, from the feedback that I've gotten. Additionally, I may even like post something where I'm going through a concept and like drawing it out, so that you can see, the anatomy and what I'm talking about, because I'm a visual person. I know a lot of people are, so I tried to come up with as many formats as possible to help get that concept concrete for you. So thank you so much for watching. This is slightly longer than I was hoping it was going to be, but it's kind of all the information for the class. So stay tuned for what's up next. Thanks, guys.